For the muscles belonging to the upper limbs, we will examine the biceps brachii, the triceps brachii, and the brachioradialis muscles. The biceps brachii is located on the anterior arm. It crosses both the shoulder joint and the elbow joint on the anterior sides, and when it contracts, it primarily flexes the forearm at the elbow joint. The triceps brachii is located on the posterior arm, crossing the posterior side of the elbow joint. Contraction of this muscle extends the forearm at the elbow, so it performs the opposite action of the biceps brachii muscle. The brachioradialis muscle, located on the anterior elbow, crosses the elbow joint. It flexes the forearm at the elbow joint, producing the same movement as the biceps brachii. It is common for the muscular system to have several muscles producing the same movement at the same joint, because some muscles have better leverage when that joint is in a certain position. Having different muscles at the same joint also allows the muscular system to produce different amounts of force or different movement at the joint, depending on which muscle is activated. Both the biceps brachii muscle and the brachioradialis muscle are visible anteriorly when the body is in anatomic position. The brachioradialis muscle is just distal to the biceps brachii muscle. Posteriorly, the triceps brachii is visible on the opposite side of the arm as the biceps brachii. Examining the muscles of the abdomen, we will turn our attention to the rectus abdominis, which is located on the anterior abdomen. It flexes the trunk when contraction occurs. On the posterior lumbar region is the latissimus dorsi, a triangular-shaped muscle that tapers to a point at which it connects to the humerus, spanning the inferior side of the shoulder joint. Contraction of the latissimus dorsi produces extension and adduction of the upper limb. Anteriorly, the rectus abdominis is a muscle that is separated into 8 pieces by tendons. Although not easily seen on this diagram, the latissimus dorsi connects to the humerus just underneath the axilla region, producing movements of the entire upper limb when it contracts.